social media aspect. And of course, the group efficiency is when it comes to efficient. Well, not a very
Yeah. We'd like to, on behalf of the Ministry of Information, Cultural Affairs and Tourism, say a big thank you to the management and staff of the Liberia Broadcasting System. KMTV is streaming this update live, SAM TV, Bridge TV, Hot TV is also streaming live. You can also log on to www.elbtradio.com. LBS Facebook page is also carrying this live, so LMTV is streaming the press conference live. I'd like to invite the Deputy Minister for Press and Public Affairs, my boss, Honorable Eugene Lavin Fagon, who will make his introductory comment, after which we will invite our speakers for today's press briefing. Minister.
Let me first of all welcome on behalf of Honorable Dr. Wilhelmina Jala, Minister of Health, all of you members of the media. Let me also do so on behalf of Honorable Len Eugene Nangwe, Minister of Information, today's COVID-19 press briefing. Today's update will be addressed by Honorable Dr. Wilhelmina Jala, the Minister of Health of the Republic of Liberia, the Chief Medical Officer of the Republic of Liberia, Dr. Francis Kita, along the Director General of the National Public Health Institute of the Republic of Liberia, Dr. Masuka Fala. We don't have a member of the Joint Security, but we were briefed as to what we will tell you at the end concerning the wearing of masks, and violators would be warned. With that said, I would like to invite Dr. Wilhelmina Jala, Minister of Health, Republic of Liberia.
Good afternoon to all, to our President, President George Manenwia, to all of the legislature, the senators, the judges, to all of the Liberian people and all the other nationals that reside within the Republic of Liberia, to the media, to adults, children. Today is another day. We are in another 14 days, and we need to see some changes. What I will say might also be reflected by Dr. Fala and also Dr. Kete. But let me say that today we have 133 cases, but good news is we have 47 people that are being released and they are going to be home under quarantine for the rest of the 14 days, and then they can come out and join the society. We have been hearing a lot about the deaths. There are 16 deaths, but only one death have occurred inside the treatment unit. The rest of the deaths have occurred in the homes, or some of them of bodies that were found in the streets that we have tested, that tested positive, so we have included them in our results. Our neighboring countries like Sierra Leone and Guinea are not testing their bodies, so the results are going to be different from the results in Liberia. Some people have said, oh, we don't have enough ventilators, but ventilator will not save your life if you stay home until the last minute and you cannot breathe and thinking that the ventilator itself will save your life. 80% of the people that they put on the ventilators do not come through, they usually die. So do not depend on ventilators and stay home until it's too late. Let me do before I go into my usual symptoms, let me say that the president had added another 14 days for us to be on lockdown, and we must take advantage of these 14 days and do something about it. This cannot be done by only the health people. It has to be done by each and every person, Liberians, non-Liberian, coming together, working together to make sure that we abide by the health regulations and do what we need to do to stamp COVID-19 out of Liberia. Now, let me give you a few symptoms. These symptoms are not limited. Maybe there are others. Maybe I left out one or two. But usually, you will have fever, tiredness, dry cough or a new onset of cough, bitter taste in your mouth, loss of smell, and finally, you will begin to have difficulty breathing. If any one of those things are happening to you right now, I would suggest that you find your way to the SKD to get tested. Do not sit and wait until it's too late. I'm sure there are many people right now that are feeling these symptoms as I speak. Maybe some of them have gone to 4 or 5 clinics and they haven't gotten any good result. Maybe they've been sick for 1, 2, or 3 weeks with these symptoms and they haven't gotten results. Or maybe they are self-medicating, meaning they're going to the pharmacy or calling a doctor or the nurse or the PA and they have prescribed for you malaria medicine that you have taken or typhoid medicine that you have taken. You have drank enough Jolobo, you have drank lemongrass tea, you have drank ginger, you have taken a couple of shots of alcohol, and your symptoms are still there. That tells you it's not the regular thing, it's COVID-19. So please, for God's sake, please do not just stay home and not go get tested. Now, one of the things the president have emphasized in his message is the fact that we all should wear our mask, but I will add to that and say, we no longer want to see your nose or your mouth. So any way that you can cover your nose or your mouth, please try and do so. There are many, many homemade masks that are floating around right now. Any style, any fashion, you can even have it to match your daily outfit. Please get one and wear it. Also, you can even use a handkerchief or even your lapel to cover your nose and your mouth. Because once you do that, you will protect the person in front of you and yourself. And this is the aim of what we are trying to do. So we continue to encourage you. We hope that the banks are listening. Do not serve anybody who does not have a mask until they get a mask, or something to cover their nose or their mouth. If they are standing in line, do not serve them. If you are in the market, you as the market person selling, please wear something over your nose and mouth. And if the customer comes, I know you need the money, but do not serve them until they cover their nose and mouth. Supermarkets, the same. Taxi, keke, and motorcycle, same. If you are just walking casually, strolling down the street, wear your mask. If you are in your bedroom or on your back porch, we cannot control whether you wear the mask there. But as long as you are out in the public where you will be seen, please, again, we must emphasize that you cover your nose and your mouth. You can wear mask. We don't encourage surgical masks because you will finish all the masks, and the medical people will have not enough to wear when they're seeing the actual patients. But you can wear homemade masks or something that will cover your nose or your mouth. One of the strategies that we are going to be using, we are creating other sample collection sites. So this boils down to communities. Different communities still have myths all over. If you sit in any gathering, people are still unbelievers. That's why so many people died when Noah was building his ark. Some people were laughing at him. So therefore, when the water started coming, all those who were left out, they drowned. Again, God will not come down to explain. COVID-19 is in over 200 countries. People are dying all around the world. And you sit in Liberia and say, I don't believe you. Somebody want money or some other story. When will you believe? When the COVID-19 reaches to your house and your family member begin to get sick, is that the time that you are going to believe? We cannot come to your individual house to explain. As we do so on the radio, as we come to various communities, this is the best that we can do. We don't want in the end, when a lot of people get sick, then you blame the health authority and say, nobody told me. So we are asking community leaders, community workers, government officials, everybody, make it clear that COVID-19 is real and is here in Liberia as it is in Sierra Leone, in Ghana, and every other African country, Ivory Coast, that are all around us. I will stop quarreling with the Liberian people as if I'm their mother, but you can never stop talking to your children. Get on board. Let's do this so that we can get this disease out of Liberia. I'm sure everybody wants to get to whatever we call normal day. This is another normal day. We want to be able to come outside. We want to be able to go to services. We want to be able to do what we did before. But it will not happen if we sit and we keep not believing. Before I take my seat, I will give you my favorite line. Again, getting COVID or coronavirus is not something to be ashamed of. Nobody should be stigmatized from coming down with this. It is very easy to spread and very easy to get. It doesn't care whether you got money or you don't have money, or you're a government official and you're not a government official. You big or small, COVID-19 is here. It does not go on vacation from 6 to 3 p.m. and come out after 3 because the lockdown starts. It's moving all day. So if you wear your mask during those hours, we will begin to reduce some of the spread of COVID-19. Thank you.
Thank you, Dr. Jallow. Thank you. Would like to, microphone, test. All right, we'd like to call on Dr. Francis Kitta. As he makes his way forward, we'd like to express our thanks to all of you, our hard-working members of the media who are all sporting your masks here today. But we hope that when they start catching people for the mask, in as much as you can wear it, you will promote it too. Thank you.
Good afternoon to all, and I think the minister basically served as the protocol, so she has laid down the protocol. So not recasting what the protocol is, I just want to say good to see every one of you, and those in Radio Land and wherever you are, it's good to see everyone. So let us begin with today's update. Today's update is very simple. We're going to have a general discussion on what is and has been cooking. That's interesting. And we're going to talk about current status, modern, and the way forward. So what is and what has been cooking? Let me begin first to express my deepest sympathy to the family of the DA boss, but most especially the joint security and everyone that have been close to him. It is sad to lose a person, a loved one, but it's also painful to see someone who has dedicated his life to protecting the general public. And so, again, we want to express our deepest condolence to the family. Let me say a special thanks to the President for his leadership and making sure that all concerned members within the joint security present themselves to the authority of COVID for appropriate actions. As I speak, they have, and we are very grateful for their participation. The process is ongoing as we speak. And so that takes care of what is cooking, what has been, and what is ongoing. So as time goes by, we are going to let you know what is cooking and what we are stirring up in the pot. Again, I'm starting with, where are we? You will see this most of the time. Public awareness and testing. We can never stop fighting this. We cannot contain this without testing. And this is what we are trying to do. We are wrapping it up. Social distancing is a priority. And I'm glad that we all, to some degree, are practicing that. The use of masks has become mandatory. The minister talked about it, but it's also important that we do that. And again, we are all in this together. This is not only those at the Ministry of Health, NPHIL, and the government leadership. Every one of us have a stake in it. And if we can all work together, we can get rid of this. Next. Let me bring you to where we are today. So this is the summary of deaths as reported. Like the minister indicated, this is where we are in terms of the reportage. 133 confirmed, and for death, we have this number 16. And like he indicated, one of this number, only one person died from the treatment unit. And so what this indicates is that please, like I indicated the last time, you have two things in your hand, a pen and a key. You can sign your own death warrant, or you can just open the door and get out and become a survivor to change the statistic. We don't want you to be part of the statistics. So let us look at health workers, because it's very important. These are people that do everything they can to fight. And so as it stands, those that are confirmed, 33, and 1 is dead. So that is the cumulative we have. Next. So what is the epi curve? As you see here, it's going. And it's going to keep going. When are we going to plateau? It depends on every one of us. We can determine when we are going to reach that peak and begin now to break the transmission. That is every one of us' responsibility. From the various communities, from individual homes, to everyone being part and parcel. So please, so we keep looking at the epi curve. Yes, it's keep going up, but we need to ask ourselves, what am I doing to carry this up? Or what am I doing to stop it? And the sooner we begin to do that, the better it is for every one of us. We have to keep honing in. So we look into where we are in the country. So if you look at Nima County here, the Tapeta area and the Sanikole area, we have cases there. In River County, the Webo area, yes, a confirmed case, Maryland, Plebo, confirmed case, Bois area, we have a confirmed case in Greenville, there's a confirmed case. But those are seedings around here. These seedings can one day turn to what you see here in Moserado County. And this is why it's very important. Remember, there came a time we had 3 cases, and sooner or later, see where we are. Next. So if we hone into this, look what is happening here. Yes, the darker it gets, the more concentrated the transmission happening, and so this area, and like we indicated before, we are going to do targeting response. And the data is telling us exactly where we need to put all of our resources. Resources are very scarce. But the way you pre-position your resources, the way you maximize the minimum that you have, will give you the kind of result that you need. And we all need a very good result. So working as a team with NPHIL and all of our other partners working along with us, we think very soon we'll begin to change this. But it takes you as an individual to help us to do this. So if we look at our precautionary observation centers, where are we? Currently, we have 15 in Grand Crew. We have 54 in Moserado County. We have 54 in Nimba, and so 123. For discharges from Moserado, 3, but 2 of them move into treatment center. So, at the military hospital, remember we talked about 2 that move into treatment centers. So those 2 were new admissions of yesterday. We discharged 2. So the cumulative discharges from the 14 military hospital has gone to 30. And by tomorrow, we may give you another good news based on what we are getting. So currently, we have 72 in treatment center. If you look down the other counties here, you find in Grand Crew we have 1, in Maryland 1, and in Greenville we have 1. So total 75. What is important is that the amount of specimen we are collecting. So the more specimen you get, the more we become so happy. And we are so glad that we can proudly say that people are yielding to giving their specimen. And so as we continue to do this, it's going to help every one of us. So yesterday we collected 68. From the 68, we have 9 positive, 1 repeat, initial negative 46, repeated test negative 10, and intermediate we have 2. And so that equates to the total 68. Next. So there was a question asked the last time, but you talk about all of these things. You didn't talk about contact line listing, and this, and so forth. So the slide is here. You can look at the cumulative contacts, those that have gone through the process, and where we are now. Next. So we come back because you kept asking. So we come back to our modeling. We are using the process and we are still working on it, but let me give you a gist of what we are doing, because there are a couple of things that we have to put in. Looking at this disease, looking at the fatality rate, looking at other conditions. And so the calculations are still going on. But let me show you at the end what you're going to see. So this is just a demo. Next. Next. So if we look at social distancing that is going on, fully enforced, hand washing not regularly adhered to, face mask use fully implemented, and this is why we decided to make it mandatory. And our quarantine and isolation, what is going on there? Now, this is what we're going to get. And what the figure going to be up here, we will tell you. But if we did our calculation, we think if we go to this place by September, this is when we're going to get to this number that we're going to give you very soon. And it's where we're going to reach, we're going to peak, and then begin to break the curve. But that will be way September. Next. And these are things that we're going to go through and so forth in the process. So the calculations are being done. Next. So how do we change what I show you? Because what I show you will be the worst scenario. So if we do these things, enforce public face masks that we all have begun, reinforce social distancing, markets banned, and these are things that we are trying to implement. Continue hand washing with soap, and isolate confirmed cases within 12 hours, and so forth. Then, of course, if we carry on these things, besides those things, if we carry on these things, coordinated intervention, specimen collection site, you heard the minister talking about that. So like the minister indicated that she was going to say things, and I will come and add to it. Dr. Fowler will also come and add. And making case investigation data available, initiate structured case findings in the cluster area. We continue and ramp up contact monitoring, ensuring compliance and improving efficiency, concomitant distribution of food and kind in the cluster areas, have psychosocial teams available to minimize stress, targeted messages for the situation, because what is going to happen, we are trying to put all of these things in place and letting you know that we are thinking of all of these things. Those are things that we have within our plan. And if we can do that effectively, this is what we're going to get. So we are, please go back. We are going to go to this. Remember, we picked up here, but if we pick down here, it's going to be very early, very, very early than you think about. Sometime before we get to June. So if we do that, based on all of these scenarios, if we begin to do that, we will be able to do that. So we are doing the calculations, and like I said, this is just a demo because we made a promise and commitment to you all, and if we don't keep our commitment, then we are breaching the trust. We don't want to breach the trust that we have with you, so we just want you to be on the alert that this is a demo. Continue. So, continue. Again, you saw this. So this is how finally we're going to end it up. The political will that we have, the technical people that we have here. You also, you are very technical in your own profession. By educating our people out there on the radio, definitely you are doing a great job. The financial aspect of it is very critical, and then that will hit to our triangular decision. So the triangular decision will get us to where we need to get. Again, no handshaking, no bumping. Thanks for the time.
Thank you. Thank you. Thank you. All right, so we will call on Dr. Masuka Fala, Director General, National Public Health Institute of the Republic of Liberia, to give us an update. Dr. Fala. Please wear your face masks, it's very important.
Yeah, good afternoon, everyone. Let me start with how the Minister of done to thank His Excellency for extending the lockdown, knowing all of these ramifications, but the fact that the country comes first and he came here to do that, fulfilling his mandate to protect every one of us. We know it's not an easy decision, but it has to be done. It's done because we want to have a safe country. And we also want to thank the Liberian people for all of us being inconvenient, but it is a necessary inconvenience for all of us, for our survival as a nation, as a people. Today I'll try to speak on 3 separate issues. One of them is the recent cases among the joint security. What do we know, some of the very good practices that have evolved from there? What can we learn as a nation? And as a testimony of the political will to see us in the outbreak. We want to speak a little bit. We've done some research work on face masks, and we're trying to discuss with you some of the alternative face masks that you can use. Some of them you can make at home. Finally, we will speak on one of the patients who've been writing a blog and accusing of whatever has happened. We think it's a misrepresentation of the facts, and we have decided to come to set the record straight. There was a joint security meeting held on the 10th. Unfortunately for us, one of the heroes in the joint security from that moment on became sick. On the night of the 23rd, we got a call and a text message that they were urgently rushing him. We tried to work with the health team and took him to the 14th military. Upon arrival, the next morning, sadly enough, he passed. And as required by protocol in Liberia, the specimen was taken and sent to the laboratory. Late that evening, the test was run. We sadly had the result that he was COVID-19 positive. We could have hidden the facts. A lot of people could have gone into hiding, but I want to say that I was really impressed with senior government officials coming forth and volunteering information of all those who were present. And so the entire day of the 24th, we can begin to arrange the logistics for all our senior officials, ministers, director of agency. We're texting them, telling them, you need to go for your testing. There are two options you have. You can go to the 14 military hospital we've done for everybody, I mean the SKD stadium, or we can test you at home if you have a fence and you want to do it discreet. I'm happy to say that we're able to reach out to 31 of these senior officials, and every one of them, all of them, volunteered to say we'll go and get tested. As late as 7 o'clock that evening, they were saying, can we go? In fact, I didn't embarrass one of them of the immigration boss. He went right away and got tested that day. He was late. He said, no, Musoka, I'm going to go and I'm going to get tested. For all, it was very impressive that the national leaders were setting good example. The rest of them set up that whole night. We worked with them trying to coordinate the logistics for their testing. Early the next morning, we set up the time by 9 a.m. Most of them had already driven to the SKD, giving their specimen. The Justice Minister and I spoke back and forth, texting, can they come to test? I said the team will come. He said, let them give my number. As soon as they arrive, let them call me. And he heroically did it, and share his number and all of that. The team worked that day. There were two teams. One team were in the field collecting specimens for those who wanted it, and this is open to the public. We always said, if you think, because what we try to do in the specimen collection is that the procedure by itself required that the sample collector wear full PPE. And we all do know the trauma and the stigma that comes from Ebola, and so we try to give people the opportunity. We say to them, we've done it repeatedly, if you have a compound, a fence, if you're comfortable for the guys to come and wear the PPE and take your specimen, it's okay with us. And so we work with that. At the end of that day, the 25th, the 26th, we have 31 specimens collected. And they were taken to the LRBR behind the Ralph International Airport for testing. I quite remember having a lot of text messages. Guys were saying, Osoka, what's going on, Dr. Fala? One of my colleagues wrote me and said, should I start packing to go to the military? I said, no, don't pack here, please wait for a result. I mean, but that's how people are waiting, and the result came in the evening. And then I text the Justice Minister, and I think he did something that was very much patriotic. He took his phone and he called the media and said, I am positive. We think that that's an extremely great example, he said. And late last night, we were on the phone, how you doing? We are praying for you. And, we asked the doctors how he's doing. But he came forward and told the media, I am positive. So I want the public to know. And he used that as a basis of sending the same messages we have, social distancing and masks. And, so far there have been 3 positive. Early this morning, most of them that say, oh, early in the morning I will go commit myself, I will be admitted. We worked till 1 a.m. last night with many of them, the other 2. They were very cooperative and said, one of them said to me, I will send my children to get tested in the morning. You do that for us? I said, no, we'll do it for you, man. For us, it's a good sign that people in leadership, all the time who don't set example, have set very good example to allow themselves to get tested, to allow themselves to go to the hospital, commit themselves to the same treatment. They not ask for any special favor. That for us, it shows a sign of political will. But the key message it gives to us is that, like the Honorable said, let's keep social distancing and let's use our masks. This disease, they have done some calculation. This disease has one of the highest R0, that is the ability of infected person to infect other people. And the only calculation that has been shown to help us are 1, the wearing of masks, 2, keeping distances, and consistent hand washing. That's the only thing that is going to save the world, because there are no treatments now and there are no vaccine right now. But they clearly have shown that countries that have done it, whether it's in China that have a commitment by the citizens to do these 3 things, can work. We have to do social distancing. We have to wash our hands religiously. And that leads us to the issue of masks, that the president have insisted now enforcing as a public policy that we all wear our masks. There are 3 major categories of masks. One of them is the N95, that is used by those that are in very high zone, that are treating patients with COVID-19, that are working with people high-risk contact. The mask depends on the size What has been shown is that 95% of the viral particle is prevented by an N95. If you ever wore an N95, you know it's difficult to wear. Many countries now have done research to show that you can reuse it because the supply are limited in the world. Next time, maybe we'll bring some sample and show you N95. Somehow, the N95 is meant to be worn by people in our order and need to be meeting as a pressure community. The second one is a medical or surgical mask. The other healthcare workers can wear, the one I'm wearing right now, is a medical surgical mask that people coughing hospital are given to wear. But what do all of us need to wear? Yesterday I spent some time going all the CDC requirements, looking at all their reports on different types of masks. They show the different types of homemade fabric that can be used. Some of them even they show t-shirts. 2 layers of t-shirt woven together to create a mask has an effective capacity to prevent you 30% from acquiring the disease. Cotton coating materials can be used. Pillowcases can be used. Pajamas can be used. They show that this material can be used and you can increase the capacity if you use a paper towel between it. If you want to sew it and you place a double layer of paper towel between, you can use it. Why am I taking this time to go all of this? So that you cannot say, I cannot get a mask to use because it is costly. They are homemade masks. In fact, there is a video shown by CDC where you can show how you can fold a t-shirt and use ordinary rubber band and create your own mask. In meetings, in open places, in everywhere you go with a group, you must wear these masks and you can do them from locally produced materials. We'll be writing out, and the Public Institute will be writing out some guidelines on the composition of the raw material and how effective it can protect you. It is good for you, it's good for others. The data show that if I wear masks, if you don't wear mask, there's almost 70% chance that I will infect you if I'm sick. There is one of our patients who just recovered. All he did was to get someone lift in his car who sat in the back seat from the distance like here to Elwa, and he got a disease. All you need to do when you're with somebody to get a disease, just the study have shown is 15 minutes. That's what you need, and then you have the disease. Like in the system now, with central air cool without ventilation, if any of us have the disease without mask, we can spread to everybody that can be at risk. And so, it is a necessary convenience for us to use the mask. You can make it at home, but it's important that we do the mask. The second thing is keep distance from others. Like I always tell people is, I don't know myself, I don't trust myself, so how should I trust you? All of us need to work with that level of high suspicion. And keep the 3 feet apart. If you have, we say 6 feet apart, but if you have masks on, you can reduce the 3 feet apart and you will be safe. Finally, because the virus can stay on surfaces, use your alcohol base and wash it as often as possible. But you walk around this morning, as I left my house to come here this morning, people are in the marketplaces, they're not respecting social distancing, and they're not even trying to put on a mask. This is just too sad. Do we want to get to the point where people start dropping dead everywhere before it will hit us? I was here, I did Ebola work in March, April, May, June. People did the same thing and laugh at us in West Point, attack us, insulted us. And I remember one of this family that we went to in the night to speak to, and this guy insulted us. It was in Port Bridge. The guy and his wife, they insulted us up and down and escorted us all the yard. 1 week later, she went Kakata with the husband in hiding. The husband died from Ebola. The husband, the man was in because she took the family to her parents behind Kakata. The mother was in the hospital. The father was there and the brother. And I walked to her and said to her, 2 weeks ago, if you had just listened to us, when I went to you in the night to beg you in the hospital, so we can test you and you insulted us, I said you will have spared your husband's life, you will have saved your father, your mother, and your brother. I said the least that any of us want to do is to bring death on our families. What every human being wants to do is to protect their family and those they love. We saw the same thing changing here where people doubted us, did the thing, so we can't reach for that to happen. Imagine the world shutting down all the airports. Well, any country want to do this, everywhere in the world. I read yesterday last time that New York had to send the dead bodies to New Jersey because there were no more funeral home and mortuary to hold the bodies. 50,000 deaths in the great US. And imagine our country. Are we waiting for people to drop dead all around us? And we're not asking for motive. We're not even saying give your blood. We're not asking for anything painful. We're not asking for 3 key things. Wear face masks, and I just explained you can make. Keep a distance and wash your hands. I think it's not a hard price to pay to save our life. Finally, one of our confirmed cases was taken to the treatment unit, and he wrote a blog and said that he called us. We did not go. When we went there, we told him that there was no test in country. For me, it was a great disservice to us in the response team. In the first place, he went to a meeting from the 2nd to the 4th, got sick around the 25th, did not inform us until we got a tip off on the 27th, on the 29th. We sent our remote team to investigate. We realized they had already gone to 2 hospitals. The team called me back. I called him the 30th and told him, I said, Mr. Rajiv, we have a system in place where people can go for voluntary testing. I said, do you want the team to come to you or do you want to go for testing? He said, tomorrow morning I can go to the drive-thru. I said, okay, go ahead, go to the drive-thru, wear your masks, and get tested. And when the result comes out, I will ensure you have the result. He drove to the SKD, gave a specimen. The result came out the next morning. When the result came out, I called one of our epidemiologists, and who have been working closely with him. He and I have been talking every time. He gave us his number. And Sumo called and Sumo said, well, we'll be coming for you to take you to the treatment unit. He said, oh, my result. He said, I'll communicate the result with you. By 12 o'clock, we call him. He had left the hub and escaped. We start calling him. He will not pick up his phone. We're calling all the numbers we have. We're calling. Everyone changed their phone, including our colleague from CDC who will not pick his phone. We had to go. We realized they were working for PSR. The way we did it, we went to PSR website and pulled a number from PSR number, and from the PSR website, and when we called him, he answered the number. And I said to him, why are you not picking our number? We've been calling on this number. We've been talking since the last 5 days, back and forth. Why are you not picking this number? He said, no, I'm at Sheriff Pharmacy. I'm confused. He said, but just stay where you are. We'll come and pick you up and take you to the treatment unit. He said, no, I can't. I will not wait here. We got to know that he did not even use his NGO car, but he ended up taking a private car. That became a new worry for us. Not only did you not endanger yourself, but you are taking a private car, a charter car to run around Monrovia. How can you do this? Later on, we got to realize that, in fact, he did not only go to a Sheriff Pharmacy, but he had gone to a hospital called Cleaning Lab to do additional blood tests after we told him he should get ready to go to the treatment unit. No matter so, we tried to get him back. He said he will not show where he is. We said, we don't want to ride any other commercial car. Just stay where you are. We'll come and pick you. They didn't listen to us. He came in the compound. We sent our ambulance team. We picked him up and took him to the treatment center. Only for us to realize that while he was sick, he had one of his co-workers with him in the house. Not only that, while he was at home sick, he had most of the staff from PSR coming to him to sign documents. They will come to the house and they will sign documents. He sat in a meeting with 40 pressing. At the end of the day, he had generated 70 contacts. But our job is to work with everyone. We took him to the place. He got admitted. The minister called me up and said he has some comorbidity. He needs to get his medicine today. We had just removed him. We had to work that whole day, get a team to disinfect the house before we could enter the house to take his medicine and carry the medicine back to him to the military hospital. So let's work both ways. In fact, one of my colleagues from CDC was so angry, US CDC was so angry. He said, the government need to deny this NGO from operating in this country. How could he be this heartless? We worked quietly with him, tried to support him, and now he goes on and writing a long narrative explaining all of these issues. So we decided to address this issue today to clear the air for the public, that we work along with him, in spite of the fact that he took a private car, he couldn't stay home, and we told him to wait for us to take him out. At the time we met him, there was no issue with the lack of kit. In fact, we encourage him. I spoke to him and said, go to the stadium, get tested. When you get tested, whatever your result will be, we'll ensure that you get your result. So we follow him immediately when we got the result, and we thought to clear the air. So in summary, our ability to end this outbreak that is global will depend on every individual decision. We wake up in the morning, we look at our loved ones, our children, is we encourage us to wear our masks. we should keep the distance. We know things are difficult, but let's keep the distance and let's wash our hands. Thank you very much.
Thank you, Dr. Fowler. To you, the members of the press, before we go quickly into the question and answers period, I want to inform you that Dr. Kita had an emergency, so he had to go attend to it. As you know, he's the Chief Medical Officer of the Republic, and when some of these very traumatic cases or other cases of importance come in where the patient is in dire need, then of course that trumps the questions. So what we will do today, you will have your questions for the Health Minister, Honorable Dr. Wilhelmina Jalla, and that of the Director General of MICAT, Dr. Masoka Fala. If you have a direct question for Dr. Francis Kita, we will reserve the question for Thursday, and I'm sure he will be more than willing to take it. Just a little bit for your records. We want to, can you give me the sheet formula right under my phone? We want to, Dr. Jalla spoke about the mask. No, under my cell phone. Thank you. And Dr. Fala spoke about that also. But it's important that we gave you the legal aspect of it, because many persons may not be aware that when something comes from the legislature, it's deemed somewhat of a strong resolution or that of a law by some. But the health regulation or the health regulations are in place for our own safety. And count 2, like I said, of the regulation was very specific, that all persons appearing in public streets building must wear a protective device that covers at least the nose and the mouth. And in count 15 and 16, it is very clear in count 15, quote, the measures contained herein may be amended to any time during the existence of the state of emergency consistent with the oversight responsibilities of the legislature. Count 16 states, quote, that the legislature shall remain seized of the matters contained herein, any law to the contrary notwithstanding. What I want to bring to your attention is that the President carried out his function and has instructed you, citizens of the country and all foreign residents within our borders, to wear a mask when stepping out of your house into public streets or public buildings. It is clear that when you wake up in the morning, in the banks, you see people without masks. That should not be happening. So again, I read that portion from the legislature because if you continue in the next 24 hours, the legislature may teach you a lesson. You are not supposed to be serving people in banks without masks. You are not supposed to be serving people at centers and allowing them into food centers or whatever without masks. To you, the taxi drivers and the pimpins and the motorcyclists, you are not to be carrying people without masks. Everyone should have on a mask. So what are we trying to say? To members of the Joint Security, the legislature has spoken. The President of the Republic of Liberia has spoken. And based on the expert advice and advices, as well as the regulations that came from the health authorities, you, members of the Joint Security, are under obligation to enforce what came from His Excellency to the legislature and what the legislature saw as even going further to help this situation. Given the fact that our numbers are increasing, I think it is high time that members of the Joint Security step up the enforcement efforts against people. While it's true we cannot police 4.5 million people, we can get 1 or 2 and that will serve as a deterrent. As Deputy Minister, if I'm not wearing my mask, I think members of the Joint Security ought to take me from my vehicle and make sure I sit on the sidewalk until I can find a mask before I continue my journey. And that should serve for any minister in government or any official in government who should know better. So if that's said, I think members of the Joint Security should begin extracting people from their cars who are not wearing masks, that are in public buildings, making sure that they're traveling our public streets. You can't police everybody, we understand, but at least when you see 5, 7 persons walking without mask, the one that has his chest open with the grip, I think it's the one you pull out aside and make sure that he sits on the ground. And don't say it's a law, I'm just recommending that because our numbers are increasing. And if you look out in the streets, some of the well-dressed people and highly educated people are the ones without masks. So what do you expect our people to be doing? In short, our joint security forces have been working assiduously hard. But again, you cannot police 4.5 million people. So our violators in the traffic, you're still carrying 4 persons on the motorcycle. You're still carrying 3 persons on the motorcycle. And in most cases, they are without mask. If those people are caught, the operators without mask, the passengers without mask, joint security need to start setting example. Since we cannot get all of them, we can at least get 1 or 2, 3 or 4, 5 or 6 a day to save this nation. To you in the traffic, taxi driver, do not carry anyone without a mask because you will be endangering your own life and the lives of your family members. Do not let them ride your car without a mask. And you should not operate the vehicle without a mask. To you, the motorcyclists and the pimping drivers, do not allow people into your vehicle without mask. You are just as guilty as the person because you are the one carrying the coronavirus from Claratown to Waterside. So what makes you not guilty? Is it because you are the pimping driver or the motorcyclist? Because you are the one transporting the virus. So if you have them in your car and the joint security arrests you or put you down from your vehicle or your motorcycle, know that it's because you are the transporter of the virus. That's why they took you. Do not argue. Again, we would like to say to the people in the marketplaces, the health minister said it, wear your mask. To the superintendent of the Liberian Marketing Association, no one should be selling in your market without a mask or we will hold you responsible because all of these people fall under your leadership. So what do? We're willing to help you with the awareness part of it. Every marketplace, if they do not have a mask, they do not have a task. What do we mean? Your task is to sell. In order to sell, you must wear a mask. If you don't wear a mask, you don't have a task. Leave the marketplaces if you don't have a mask. To those of you going to the market to shop, we encourage you to wear a mask. We advise you to wear a mask. We're telling you by way of the health regulation, we're ordering you to wear a mask because the marketplace is a public place. It is not your house. If you are there, you will be in violation. And just because members of the joint security don't pick you up does not mean you're safe. It has come to the attention of the government also that there are certain individuals still holding waykeepings. I repeat, certain individuals still holding waykeepings and large burial ceremonies. We are seeing that when they do the Facebook posting. It's supposed to be 10, but over 7,500, we have seen it. If you do that, you might not be able to bury because you could get arrested. We're again advising you and encouraging you that the one person out of the 100 people you invite could contaminate another 40 from there, or even 10. And then the 10 will go home and again infect another 40. We don't want to get overwhelmed. So we are advising you to stop. 10 persons to attend the burial, no more than 10. No waykeepings. Again, we are advising. Now, let me state for the record, it has come to our attention also that individuals will go to testing centers and you will have talk show hosts announcing their names even before the senior medical staff, the incident management committee heads even get the results. Their names are being announced by some of you on Facebook before the test can even go to the laboratory. We want to warn anyone that is bent on leaking information to desist now. I repeat, desist now, or have yourself to blame later. Why are we saying so? Every individual that goes for testing is a patient, and that patient has a right. That right is to his privacy. If he does not want anybody to know his business, that is his prerogative. But if you're caught, you will have yourself to blame. We have gotten cooperation from community within our country, communities, where they have people washing hands and making sure that they adhere to the health protocols. We're going a step further. If you are now wearing a mask, just like you refuse to wash your hands, and at the checkpoint they tell you you can't enter, if you are now wearing a mask, they will ask you not to enter their communities. Please respect them. All they are trying to do is to save themselves. What am I trying to say? If you decide to go into a VOA community, make sure you have on a mask. Or else, if they ask you not to enter the community, do not fight them. With that said, we will proceed to take your questions. Please state your name, the institution you work for, and to whom your question is directed, excluding Dr. Kite. Thank you.
Okay, my name is Joyce Snyder. I report for Reuters News. My question is to Dr. Jala. Concerning this hand wash, you just talked about it, I spoke about it. I realized a great wave of checkpoints, hand washing checkpoints in every community. And most of the time we don't hear people talking about it. And I would love the minister to speak about it. If it's something that we know it wasn't part of the official statement from the president, but it's been happening. So we need the minister to talk about it a bit, because I've witnessed tension in communities for people refusing to wash their hands. So I would really like the minister to say something about it.
Thank you. Minister, my name is Dr. Kite and I report for OPFM. My first question is to Dr. Fala. I'd like you to follow clarity. You talk about 31 single issues have been tested so far in terms of the specimens. That was the year that 3 of the 31 is confirmed positive. I'd like to get a clarity further. Now, second, are you also concerned with that? Are you also concerned their family members, and how far are you going in the arrangement of those 31 senior government officials, family members, and those who will be in contact with unknowingly? My second question is to Dr. Jala. As we currently face the epidemic, this pandemic in our country, no health supplies or medical supplies to other health facilities across the country. I'd like to know when does the presentation to health facilities in terms of medical supplies to health facility aside from COVID-19 drugs or whatsoever. My next question is, Dr. Fala, maybe Dr. Fala will share that, and maybe Dr. Kite will share that also. Why is said usually they take you 12 hours. I always listen to you talk about 12 hours in terms of isolation, contact with different cases into your treatment unit. Why is it 12 hours?
Why does it take 12 hours to get a result?
12 hours to get the treatment unit, to get through all the protocols that you have to follow. Why is it take 12 hours? I listen to your presentation once, and I listen to Dr. Keta also doing
We think the money is always kind of the protocol to everything. And my question goes to Ms. Jala. You express your disappointment and dissatisfaction as relates to continuous violation of those rules and regulations, and which is also followed in very many cases in the country. Now, what those measures in social distancing, the use of the face mask, can be instructed to the Lagos Council of Churches to allow celebration?
Well, thank you. My name is Mr. and I write for the West African Ballot newspaper. My question can be addressed by the health authorities. And it's about whether there is a proven result on whether this virus can be transferred through the use of usage of bathroom. Because especially for our females in terms of the way in which they use the bathroom, whether this virus can be transferred through the use of bathroom. And specifically, Dr. Fala, why I read the answer to this question I just asked, Dr. Fala should please address this one. What would be your advice as public health specialists to Liberians, especially women and girls, in terms of using bathroom out of their homes? Thank you.
Thank you. Good afternoon. I'm Bill Cooper. I write for the Empire newspaper. The question goes to Dr. Jana. Dr. Jana, if you visit your communities, you will see people, other citizens, they are carrying some community initiative. Let's say washing some paint before people can join into that community. Are there plans in place by health authority to empower those community dwellers in order to help them carrying this process until we can see the virus is no longer a threat to the country? Because if you look at those initiatives of these people, let's say a year was interest in government help or aim eradicate the virus of the country. The next one has to do with the mask issues. Now they are being mandatory by all citizens to wear masks. When you did come up about the health measures, that citizens realized that citizens were violating the health measures, and now they are being mandatory. And there are plans in place by the government to ensure that citizens abide by these measures.
Okay, thank you very much. Like I said, I'm the deputy spokesperson for the government. And so, you know, Dr. Wilhelmina Jala and Dr. Masoka Fala both works for the government. And so it's our responsibility to checkmate some of these questions and make sure that they continue to handle the technical aspect and let the political aspect be left to us to handle. So with respect to, are there plans for the government to handle the enforcement aspect? It's not planned. The enforcement is in place already. The joint security was sent out there to make sure that the health protocols were enforced. And that's why the chief of staff was ordered by the president to get the military also involved. So the question as to whether there are plans to ensure that it's enforced, there's no plan, but rather there's an action ongoing right now. The plan was long since hashed, and the technical advice was given by the health authorities, and the government moved to bring in the joint security. The government brought in the joint security, and the joint security has been working. As far as the enforcement, that's another question. But whether there are plans, the plan has already been given some serious actions as we speak. The other question had to do with the community hand washing protocols as to whether it's sanctioned by the authorities. I will leave the part to Dr. Jala that says, are there any plans to help them in the future? That's a different question. But as to whether they have the right every community does have the right to health. And we have, all communities have community chairmen and chairpersons, but it's their right, and it's their community. They have the right to safety, they have the right to health. What we want to state here is that the community leadership took a decision to put out their barrels and to make sure people who enter the community, the various communities, respect the protocols laid down by the health authorities, and people have been cooperating. So let's encourage that. It's a community initiative. It's not something that the health authorities forced on those communities. And the last thing I want to say is, if we have a healthy community, we will not be giving Dr. Jala and others the problems. So those communities will now proceed, after the hand washing and other protocols, to enforce again the wearing of masks before you enter the community. You don't want to enter someone's community to spread the virus, do you? So if you don't want to cooperate with them to enter the community in your big car and in your flashy vehicle or whatsoever, you must be wearing a mask. We'll call on Dr. Jala to address the other part of the questions. Thank you.
I missed one of the questions from the second person, but let me say that we encourage the hand washing in the community. It's important that you keep your community healthy, because I think in Liberia, when we say government, we're looking at somebody else, but we're forgetting that we all make up the government. Whether you're working or you're not working, you're still part of this government. So therefore, whatever you do in your community is very important. Now, there are many people in every community that can assist in terms of the buckets. Most of the buckets are already there. The water is already there. It's only the soap that you need to add. So I'm sure if your community is together with the correct structure, you should be able to get some kind of support within your community. For me to say that maybe later on we will be able to help, I cannot say that now, because COVID-19 is not like Ebola when there was millions and millions of dollars in the country. Now you have everybody, every other country fighting coronavirus. So you within your own country have to do the best that you can to prevent the coronavirus. Yes, we have partners, but the partners cannot leave, so they are here with us. So we are asking you, you know, people call and say, can you support the youth in my community? But right now, how will we support the youth? We don't even have enough money to continue the fight. The ones that the government provide, we have to use it wisely to make sure that we can continue the fight. So for now, we cannot go to different communities and start allocating funding for them to continue. But we encourage you as a government within your community to continue the fight. And if the time arises where there is enough funding to give, we will give. Also, somebody was concerned about routine health services. Routine health services are ongoing. We just completed our distribution. In Monserrato and Mount Gibby County, we deliver directly to the facilities. In the other county, we deliver to the county depot that takes it to the facility. So if you have heard that your facility or a facility did not receive, please contact us so we can make sure we find out where was the drugs that were delivered. With the drugs that we have been delivering for routine services, we have added PPEs and other things to make sure that we buttress where you have so that you can keep up the work that you're supposed to do. Now, I missed the other question. What was the question that somebody asked?
About the church.
What are the
Whether they will be allowed to work in same markets or...
Yeah, the issue about the children, talk about who are not using the face line in the streets, and we still see some violation going on. What can you give the broadcast of churches the same structure to? We're going to see, I mean, activities in our churches, go to church every Sunday.
Okay, so for now, the regulations that were set remains, and at the point which they open up everything again, we'll open gradually, but first we got to close, and then we reopen. As we reopen, those options will exist. But for now, we are all following the protocol. Services closed and other activities suspended until further notice, as we see improvement in the situation in Liberia, and we can advise the president to lift some of these measures.
Thank you. Thanks for the questions. Yes, we said 3 out of the 31 specimens were collected, were positive, and we said if all are now in the 14 military hospital for treatment. I also stated that, in fact, even before they could go this morning, some of them already started asking how we can get their children to be tested. So every confirmed case, we contact trace, we identify the contact, and we test the contact. In fact, from the index cases yesterday, the family went to the stadium and got their specimen were collected. The wife of our deceased brother got tested in the family, and thankfully they were negative. So yes, the family has been tested, and it's 3 out of 31. So now it's to look at those 3 now and find their contacts, and they've been cooperating with us. The very important thing is that somebody desired to go to the treatment center to go for testing, indicate that this person will give you the true information. There is no magic hour to say there's a 12 hour for everything. There's no magic number. But assuming we get a call in the morning and we pick out the specimen, we collect specimen, a couple of days, we have a team called Riders for Health for motorbike that move the specimen to the testing center behind the airport. So you take about 1 hour going to the airport. It takes about 6 hours to 7 hours to 8 hours to get the result done. We have 2 teams of 5 team of 4 men each. They're working day and night. So the team that goes in the morning get the specimen. So by 8 hours we can have the result. When someone gets picked up, the earliest possible, but there's always an issue of trying to respect the person. It's a mindset. You know, like one of the person I was talking to, I said, you okay? She said, I'm ready to step. It's a mindset. That's how psychosocial people talk to them, encourage them to want to go. You know, also will be happy if I call you and say you are positive for COVID-19. You know, you go into fear. So it's a process. We work with them until they're ready, then we'll send an ambulance to pick them up. So it varies from, it's not a 12-hour window. It can vary for as quickly as 2 hours. Like 1 hour cases even went very early enough to us, within the first 1 or 2 hours, they were already present. So there's no magic hour. I just explained to you, it's just that the testing takes a longer time. But if you are already a suspect case, there's no need to explain. If you are a suspect case, that is, you are presenting with fever, you having cough and fever, difficulty breathing, our goal is to immediately take you from the population and take you to a separate hospital on Marshall Highway that will keep you there and then run your test. If your result comes off positive, then we'll move you to the 14 military. If it comes out negative, we keep you and then repeat the test within 24 hours. Use of bathroom, that's a very good question. And we do know the question to address this question is to know how the disease is spread. It's spread through direct contact and through droplet. It can be on surfaces, right? It can be on surfaces. There are studies that show that 30% of the people who have COVID-19 will share in their stool, their feces, starting by day 5. All of these indicate that indeed bathroom will be a potential source of transmission. So again, the fundamental reason why you want to carry your own alcohol-based sanitizers, and I will encourage our sister, all of us, when you go there, you can even wipe the surface, because it's surface contact, right? And then wash your hands, because even if you're using the bathroom, we don't know whether there's any fecal oral route of transmission. We have not had that. It's no document have said that. It's the way we know that it gets spread is through touching your face and mouth and nose. And so all the more reason why we encourage people to wash their hands. The same simple hand hygiene, when you leave the bathroom, wash your hands and wash your hands. And then try your hand sanitizer. That's what we can encourage, not only for the girls, but even for the men. All of us, when you use the bathroom, after you use the bathroom, wash your hands, wash your hands. When you shake hands with people, because this virus can stay on the surface from 5 hours. For 4 days, it can be on the surface and it will infect you. So the reason why we're using the mask to prevent us from touching here, and then we wash our hands to remove the virus. So not only for the female, for all of us that go in the bathroom, make sure it is washed. If you in there, take a set of tissue, sanitize the floor, the bathroom floor, and then when you are done, wash your hands. Thank you very much.
Ladies and gentlemen of the media, before we close, we would like to encourage our citizens and residents within the various communities to help the community teams, because if you help them with a little bit of soap, I do that in my community. When I move up to the checkpoint, sometimes if I don't want to give them the money, I buy them a little roll of the clean Thai soap. I give it to them, little bottles of chlorine. We can all do that as we're all in this together. If you're able to get a little bit of Thai soap into the water to wash hands, it will save your community also. To the people at those checkpoints in the communities, make sure you are not harassing citizens, make sure you're not threatening them, and make sure you're not putting them under pressure for monies or anything. And to those of us wanting to move from one community to the other community, you are encouraged to respect the people in their communities. If they don't want you to come in without washing your hands, respect that. It's their community. The law allows for you to move freely. The same law encourages you to wash your hands. But the law now makes it mandatory. I repeat, the law now makes it mandatory for you to wear masks. So to be moving into someone else's community without a mask, you are already in violation. So if they ask you not to come into the community, just obey. To those of you selling the locally produced masks, the best place to sell them, I'll be your salesman now, is at police checkpoints and community checkpoints. Because if I get to the checkpoint and I don't have on a mask and I really want to go in, I can spare the $200 and buy me a quick mask and wear it. To you, the members of the media, you've demonstrated high level of professionalism and you have obeyed the law. I want to thank you, but I also want to encourage you to please help us spread the word. The mask is very effective. Thank you very much, and God bless you all.
And so this is how we come to the end of today's briefing. My name is Godfrey Bedu-Kwanzaa. Thanks for staying with us from the headquarters of the Ministry of Health. Thanks for watching KNTV. Thanks for your many comments. It's bye-bye for now.